Hi, my name is Stacey Pogue. I'm a senior policy analyst with the Center for Public Policy Priorities, where we believe everyone needs a chance to compete and succeed in life. I have given you much longer comments that I am not going to go over all the slides you have. I hope some are useful background or reference.
We appreciate that.
Of course. First, I want to say of the problems I'm speaking to, surprise medical billing and network adequacy, that these are interrelated issues, but that we need the legislature to focus on both issues, that a fix to one doesn't necessarily fix the other, although fixes to one will improve the other. We need to look at both, and so I appreciate that the charge is broad and looks at both. And first, I want to speak to surprise medical billing, especially in emergencies, and point out that we have a systemic problem with medical billing and surprise billing, and it's not one that's just consumers' fault because they don't understand their plans, or that we need to look to just to hospitals who contract out to out-of-network physician groups. And it's not just that doctors' charges are too high and insurance reimbursement rates are too low, right? It's the entire kind of broken system that consumers must navigate. On slide 3, I'll point out one piece that speaks to the scope of the problem. The Consumer Reports National Research Center did surveys in Texas of consumers and found that over a 2-year period, 1 out of 3 privately insured Texans received a surprise medical bill. So certainly it is a big issue for consumers. I know clearly you guys are hearing about it. On slide 5, I wanted to talk about why consumer and patient groups are focusing on emergencies as the place that we're suggesting we need to do the next incremental step on consumer protection for surprise bills. So CPPP is working in coalition with a number of consumer groups, including the National Multiple Sclerosis Society, AARP, the American Heart Association, the American Cancer Society, and Consumers Union. And all of us feel that at this point, emergency care is where we need to focus, because none of us, no matter where we're sitting in this room, can control the care in an emergency and be sure that in an emergency we're not going to get out-of-network care unknowingly. We don't get to pick our doctors. We don't tell the ambulance where to go, right? But it's also because the data show us that this is a problem it's a particularly large problem for consumers, that it is very common that a consumer will get an out-of-network emergency service even if they go to an in-network hospital, and that we have a lot of hospitals in the state that contract with an insurance company but have not one single ER physician under that roof that takes that same insurance plan. And I've provided a graph of that on slide 5 for you. So where we think, we've got kind of 4 principles that these groups are working from on what we need to do next, again, the next incremental step to focus hopefully on surprise emergency bills, is that we believe Texans should be protected from surprise bills in an emergency, that it's important that patients pay their often sizable deductibles, co-payments, and co-insurance, but it's this piece of the unexpected charges that shouldn't be foisted off onto consumers in emergencies. That Texans recovering from emergencies shouldn't be asked to bear a burden of ensuring that they get a consumer protection that the legislature wants them to have, and I'll speak more to that in a minute. That providers and insurers can continue using the existing mediation system we have today. I suspect on the next panel you're going to hear from them that they think that system's working pretty well for them, and they should be able to use that directly, because we definitely feel that providers should be paid a fair and adequate price. And it sounds like most parties are really happy with that system for reaching agreement for out-of-network payment rates. And last, that there shouldn't be loopholes. Texans with state-regulated insurance should all have protections if they have an emergency. So on slide 7, I've listed what some of those loopholes are, who's left out. If you had an emergency, you get out-of-network care unknowingly, who can't use mediation today? One is if where you go in an emergency is an out-of-network hospital or a freestanding ER, whether or not it's in or out of network, you don't have access to mediation today. Today, if you get a surprise bill that's under $500, even if you get several that add up to more than $500, you don't have access. I have examples of stories from Texans here, courtesy of Consumers Union. For example, Matt in Austin, who took his daughter to the ER when she was having trouble breathing and ended up with a $450 surprise bill. Sonia from Grapevine that had one that was about $350. So we hear reports of these consumers that are still locked out. And also bills from provider types that aren't one of the 6 named hospital-based physician types. One of the stories we hear most often is ambulances. In an emergency, an ambulance takes you to a hospital, but that ambulance is out of network. For example, Terry Ann Richardson, who received a surprise bill that was $990 from an ambulance. On the next slide, I want to talk about one of the other things that keeps people out of mediation is how we've structured the consumer protection. So before a consumer ever gets a balanced bill, the insurance companies looked at that and said, wait, that value of that bill charge, that value for that service is wrong. We're not going to pay that. Then the doctor looks at it or the provider looks at it and says, wait, that value for the service that you've sent us, we don't think that's right. It is wrong. So they both think there's a problem with that bill. And then I'd submit, from my perspective, they together send you that balanced bill. And I know that the return address on the bill is going to be the provider's office. But I think it's together, they are sending you that balanced bill because they've looked at it and said, we think something's wrong here, but we're not required to figure it out at this process. So we're going to foist it off on you, and it's yours to deal with. And now the protection we have in law depends on you as the consumer noticing that there's a problem with that bill, right? First, you have to figure out that there's a balanced bill, which is not easy. I've included a bill here that's a balanced bill, and you'll see there's no red letter on it with a big circle. It says, here's the balance, right? It says, you went to the emergency room, you were treated there. These are the medical services given to you, and here's the total, right? Then you have to understand you have a mediation right. Then you have to go to the Texas Department of Insurance and learn about the mediation system. You have to decode your bill to see if it's eligible. You have to fill out a 3-page form, right? I think we just talked in the last panel on network adequacy about, all of the things that could happen for a consumer to get to a point where they complain to get a protection. And we have a system that requires consumers to decode bills. And I think it does two things that are both unfortunate outcomes. I think there's fewer people protected because we put the onus on the consumer. I think that might work well for providers and insurers who go to mediation less, but I don't think it works well for consumers. And the other thing is I think we end up giving the least help to the consumers who need it most. So imagine 2 ER scenarios. One is I'm cooking in the kitchen. I cut my finger, what looks like badly. I go to the ER. I get it stitched up. I don't have nerve damage. Maybe it's an easy recovery, and I get 2 bills, a hospital bill and an ER physician bill. But imagine if I have a stroke, and I go through the ER, but I'm admitted inpatient, and then I have weeks and months of follow-up care, and I have a mountain of bills, and a new one's coming every day. I have cognitive impairments. I can't return to work. My family's reeling from a loss of income from my disability, from the health care that's needed. The different capacity of those 2 families to figure out, navigate a complicated medical billing system, to know where to ask for help, to figure out which bill in that mountain you can mediate. It's a lot to put on consumers. And so I'd suggest that is not the appropriate way to structure a consumer protection. I've given you some examples on slide 10 of some states that have done it really.
Stacey, could I get you to, we have this information here that we can read through, so if I could get you to hit the highlights for us.
I'll do the rest super quickly.
In consideration of everybody else's time. We're kind of running a little bit late, so.
I'll say Florida is a state that has a roadmap that I think we should look at. They've protected consumers very well for surprise billing in emergencies and out. That was pretty broadly accepted by stakeholders, just signed a couple months ago, and I've included some more information on it here and some information on how dispute resolution has been being used in New York for a little bit over a year now. And on the network adequacy front, I will boil it down to this point. I think with the rise of narrow networks, it's even more important now that our regulators are asking, that legislators are asking, that consumers are asking for an adequate review of networks and the right capacity of the department to review those networks and the right questions, which is it narrow or not? It needs to be clearly, and it is more complex than that. It's can consumers get the right care in a timely manner without having to go too far? And that's a very complicated analysis, and we need to make sure we have equipped the Department of Insurance to do that on an ongoing basis well. That is all I will add. If you've got questions, I'm happy to answer them, and certainly you have much more information in your packet.
I appreciate that. This is a great packet. Members, are there any questions? Representative Paul?
This balanced billing situation coming up, have you ever seen a case where the doctors or the hospital might bill for the same service more than once based on getting more information back from the insurance company?
I guess I'd say I've certainly seen provider bills that change over time. You might get one before it's been adjudicated through the claims process, and then one after, or then one after your deductible payment was received. So certainly I've seen a series of bills where the amount changes, for reasons of how that bill's processed.
Yeah, based on, hey, well, the insurance company, we thought they'd pay X, but they didn't, so now we need to charge you more, or we're going to give you a refund. We don't need to give you that much. But I was just wondering if that's a very often thing or not.
I have no idea how often that happens, but it's certainly one of the 100 complexities, right, for a consumer to dig through these mountains of bills.
All right.
Members, any other questions? All right, thank you.